Hey, hi, hello to all the Facebook friends, senior, junior, who are watching online discussion under the heading of the Live Pharma Coalition. Live Pharma Coalitions brought to you various experts from the various different department, marketing, sales, research and development, academic, QC, QA, packaging, regulatory, supply chain, finance, HR, and other pharma departments every month. This is enlightening the knowledge about current happenings and the future in the various department and subfield of the pharma at a single glance. Here, as introductory slides, I would like to share my screen. Hope it's visible to all of you. Welcome all audience as well as the speaker for LPC-60. That is the young episodes. The topic is a very excellent topic: marketing challenges, opportunity, and customer connect in this era. And this LPC-60 young, it is supported by the KMP. It's empower the retail segment. As you know that the Live Pharma Coalition currently is the India's largest online discussion platform, and Live Pharma Coalitions, we call it as a LPC. LPC is a learning and sharing platform. When it comes to the objective of LPC is the speakers, they express their view as per the experience and the knowledge of the pharma professionals. Non-commercial online platforms, nothing to do with any organization or confidential information. Audience and the viewers will get the pharma experience, the great learning from them. Development of the speaker and the audience and the viewers, it goes hand to hand. Various departments, I just said it, it's connected with each other for the every week. International domestic business, digital marketing is a part of the marketing, research development and or the academic parts, learning and development, supply chain, finance, HR. Week-wise, we did the bifurcations. Here we are here on the week 3. That is a young leadership. Here we will have great discussions onto marketing from our marketing leaders, those who is at the very younger age. Week 1 is for the leadership. Week 2 is for the global. Week 4 is for the academic. 5th is for the women. Numbers at the LPC Facebook page. This video it reaches to a 20,000 plus 1 month of the time. 125 plus LPC speaker model panels are there into the WhatsApp group. 60 plus live audience, we do have it. Now coming to the both the platforms of the LPC Facebook page, we have 1328 people like, 2072 people follow our the Facebook page, and most viewed the LPC 37 sessions on the Facebook page. That is the 4.5 thousand people they have seen LPC 37 episodes or sessions. YouTube channel, we have a 934 subscriber, 60 videos currently we do have it, and LPC 8 is the most viewed onto the YouTube channel, that is 799 people. I would like to thanks the last episode, that is a 59 live audience, those who was watch us and followed us, like our the sessions. Parallelly onto a YouTube, our the people highest number that last time we got it for the LPC 59, that is 52 live audience. Thanks to all of them, and keep doing subscriptions to our YouTube channel. Coming to the LPC 60 or the young leadership team, here today we will be here. So along with our 3 speaker, that is the Pranka Srivastava sir, Sandeep Dey sir, and Sumendu Mahapatra sir. We have 2 the very dynamic panelists today. That is the Samat Kumar Shaw. He is currently working as a DGM INCO. He is a parallel panelist with the ISIS Verma sir. He is the executive of LPC and founder of the Pharma. Along with me, there will be the 2 co-moderator here. We will have it, Amit and Amit Saha. Along with the Amit Saha, there will be the Arpan Kumar Paul. Arpan, he is also our LPC executive committee member, along with the Sarad. So over to both the panelists to take it ahead, as I will be moderating these sessions. Got an opportunity to moderate. Over to you,
yeah.
And Sarad.
Thank you, Raman. Thank you. And good morning, all Facebook and YouTube friends. So once again, we are back with one of the most important topic, because a pharma cannot survive without marketing, and now marketing has a lot of challenges. To address those challenges and opportunities, so we have 3 eminent speakers. Mr. Pankaj Srivastava, and Mr. Sandeep De, and Mr. Soumyendu. So I would like all the three speakers one by one to just discuss about the topic that what they're going to share. Pankaj sir, over to you.
Okay, Vermaji. So the topic what I'm going to discuss right now is what are the marketing challenges in this present pandemic, as to what are the things which are required to be slightly changed because the situation has completely changed in this pandemic. So with the same old business model, you may not be able to get the type of results what you are anticipating. So that's what I'm going to touch upon.
Exactly. Very, very, very true. And I hope people will get a lot of insights, sir. Thank you. Thank you very much. Yeah, Sandeep Jaji, your topic and brief. Intro.
Good morning to all, and good morning to the audience. So, as the broad topic of this session is the marketing challenges, opportunities, and the customer connect in the pandemic. And as Mr. Pankaj is going to cover the marketing challenges, so I am going to talk about the opportunities because every crisis brings opportunities. So this is a old saying. So I will try to focus on the opportunities which we have seen, especially in last 14 months during this pandemic. I believe that will be beneficial for the team and for the audience to view on that how they can think forward, even in the forthcoming pandemics or forthcoming crisis. Thank you.
That's awesome. That's awesome. I think that will add a lot of value because every challenge will have an opportunity, and that's what you're going to discuss, Sandeep. Thank you very much, Soumyendu ji.
Yeah, hi. Good morning, everyone, and good morning, viewers. So, as challenges is there in marketing and opportunities are there. So, somebody has to talk on more on solution. And I don't know what solution is available, but at least we are transforming ourselves in this specifically in this pandemic era. We're
Yeah.
transforming ourselves from physical to digital, and now it's a something called a physical era. So how we are transforming ourselves, I would like to touch upon on these points. I'm definitely sure that viewers will be, get a good, mix how to touch upon the patient front, because which is a very important thing in pharma industry. How other industry has moved, but pharma industry needs to still move into that era, digital era. So I will touch upon on that particular point.
That's really great, and that will give a 360-degree approach towards we identify the problem, and we give the what are the opportunities, and also we'll see some of the solutions what industries practicing. That's what Soumyendu ji will address. So we have with us apart from our eminent speakers, Amit Saha. So Amit was the one who reported to me, and we were a great team in Hyderabad. And nice to see Amit again on Life Pharma Coalition. Welcome, Amit.
Same here, sir. Same here. It's great to see you and great to hear you, sir.
Thank you, thank you. So with with your expertise, definitely we are going to get a lot of insights into the session. And also we have Mr. Sanat. So Sanat is the co-panelist along with me, and who will add value through marketing insights. Sanat.
Yeah, good morning, everyone. I'm sure the way we have been progressing in last 14 months during this pandemic, we must have touched some of you and must have contributed virtually some of the aspects which we must have benefited you. We are sure in the coming time also we'll try to touch each and every point which will be benefiting for you in your career building. We are trying our best, and at the same time we would be looking forward for your support and consistent participation, which will help us in guiding and taking this LPC to the next level altogether.
Awesome, awesome, Sanat. And we have also our story, the corporate storyteller with us today, Mr. Arpan Kumar Paul.
Yes. Good morning, ICS sir, and good morning to all the viewers on Facebook and YouTube who have been constantly watching us for the past 60 weeks. In fact, it is always said that a challenge is the beginning of an opportunity, and LPC is a burning example of that. a thought process which came to the mind of Mr. Raman Marke in June 2020 has transformed into what it is in June 2021. So we have already walked 60 episodes, growing faster and stronger with each episode. And our audience have been very dear to us and have always been with us, supported us through our thick and thin. So thank you so much to the live audience as well as the speakers who have given wonderful presentations to keep the audience glued to each and every episode of LPC. So today on LPC 60, we once again have a fantastic panel of speakers as well as moderators and panelists who are going to bring out a wonderful and learning experience for all our viewers. So stay tuned with us and thank you so much. Over to you, ICS sir.
Thank you, Arpan, and thank you, Amit and Sanat, and thank you, the speakers. So now I would like to introduce and welcome Pankaj. Pankaj is a seasoned professional with a lot of experience in marketing and also into training, and he is a part of our Life Pharma Coalition Young as an executive member. So I would like to introduce him. He has 38 years of experience in pharma industry, which is tremendous because after 20 years we felt that we have done so much, and he has exactly double the experience that what we have. And he is mainly worked in Sanofi and MSD, the MNCs, and done different roles in sales and marketing as well as in training. So currently he is working as a vice president marketing and training with Bituxa Pharma, and also the founder of Winning Ways. You could see him speaking a lot of a lot of insights and the things on pharma in YouTube as well as in Facebook. Welcome, Pankaj to the topic, and yeah, over to you.
Thank you. So very good morning, colleagues, all the colleagues who are in Facebook as well as YouTube Live. Well, as the topic which has been given to me is what are the marketing challenges in this present situation? And I would like to start by simply saying that change is the way of life. Things were not there in yesteryears. Things are not, the present situation also poses a different sort of challenges. And even moving forward also, you never know what are the different types of situations which we'll have to face. And therefore, the skill sets which are required will also keep on changing, right? The situations will also keep on changing. And this definitely poses a different set of challenges when it comes to the marketeers. Now, I want to declare one thing, that there are no PowerPoint presentations, what I'm going to do. And therefore, I would like to build a better connect with you, because you'll have to listen to me what I'm trying to say and try to make out meaning out of this. Now, the entire talk I'm going to base in two segments. What are the strategic challenges and what will be the tactical challenges, in marketing in the present situation. Now, when this topic was assigned to me, I was thinking about that, what are the things which are happening currently? What are the businesses which are flourishing? And what are the businesses which are not doing well? The entire hospitality industry, for instance, that's not doing well. But there are some businesses which are doing extremely well. And I was, thinking about Amazon, the way they have been doing business, the Flipkarts, they have been doing business. Even in grocery items also, there are so many online channels like Big Bazaar and all this. They are doing exceptional business. Now, I was also thinking, what is their major USP? Why is it so that they are doing such a phenomenal business, whereas others are not able to do such a phenomenal business? And I came to one conclusion, that, when I see the catalog of, say, Amazon, and I see some product and the price, even though there is no look and feel of that product, still I just simply place the order for that. Why? Because I have got tremendous trust in that product, in that company, right? And that is one of the reasons. If you go deeper into that, you will find that wherever you have got trust, in the companies, you will be able to come and rally around, and the customer retention is going to be much more as compared to those situations where the trust is, coming down, it's plummeting. Now, you think about pharma companies. I mean, I don't want to say that the trust as such was little bit low, even in yesteryears. And this trust has further come down during this pandemic. I mean, we are at a very, very, poor stage when it comes to trusting relations with the patients. I mean, what all has happened, right? Now, therefore, I think the biggest challenge currently, which most of the marketeers, which they are going to face is how you are going to restore that trust, right? And of course, Ramandu is going to talk a lot about, what are the various solutions, what, the pharma companies can offer. But I will give you just one example later on where I'll try to give you some glimpse of that, how you can little bit tackle about this marketing challenge, which is very much there. Because trust, until unless you are able to restore that, you will not be able to build connect with the customers. Now, one or two points, on that. First thing is that whatever you commit, you fulfill that. Walk the talk. Do not commit anything which you cannot fulfill. I mean, that's the first thing which I'd like to highlight here. And the second thing, which is again a very important facet of building trust, is that there has to be some sort of emotional connect with the customers. How you can do that? What are the pain points which the customers are having? How you are going to address that? If you are able to do that, you will be able to restore some amount of trust. And of course, there are so many other facets which you have to bring in if you want to build trust, with the customers. Because trusting relationships, it takes a lot of time to build. But in one or two instances which you do, the trust actually goes off. And that's what has happened. I mean, so many products which were very much required during COVID. I mean, what has happened to that? The type of black marketing, all these sentiments, all these things have actually brought down the sentiments when it comes to pharma industry. So that's my first point, which I'd like to highlight. You have to somehow restore trust within the, as far as the patients are concerned. That's the first thing. And in fact, if you see, there is a study also which was done in 2020 in USA by this Edelman Trust. There also they have found out that even in US, the overall trust which people were having in various companies, I'm not referring only pharma industry, that has also come down. So it's a global phenomenon which has happened during this pandemic, right? Because of various reasons. So trust, restoration of trust is first and foremost. Second thing is, when the situations they change, the requirements also change. Now, there was a time when we were talking about product centricity. I mean, I know when I was, working and say 20 years back, I mean, we were mostly focusing on product. We were, entire thing was revolving around product. But now we are talking about patient centricity, right? Everybody's talking about patient centricity. And if you ask me, what is in simple words patient centricity? It's nothing. You put the patient in the fulcrum, and all the paraphernalia, what you are trying to build, is around this patient. I mean, in simple words, this is, to me, that's my understanding of patient centricity, nothing else. Now, if that is the case, you have to dig deeper into what are the pain points, what are the requirements of this patient in this present situation, in this present pandemic. Now, I mean, you can therefore, have the deep customer insights. And when you are doing that, you can think about what are their secret needs, stated needs, unstated needs, all these needs, you have to do that. You can do the brainstorming and arrive at the real crux of the problem, what the patient is right now facing. What even our customers, another customer, doctors are facing. I mean, very often we say these days, the biggest problem doctors are, what the pharma companies are facing, doctors are not giving time. They are not listening. Now, think about it. I know in my family, there's a surgeon, I mean, my son-in-law, and I mean, I was talking to him, I mean, how are you working? He said, look, I'm going to 4 hospitals. I mean, I'm bombarded with so many patients, even COVID patients. Sometimes I have to operate on them in sometimes dire emergencies. And, it poses different sorts of problems. Now, when that is the case, he is not in a state of mind to listen to the scientific content which the pharma companies are going to do. What he is looking forward is, can somebody come and help me? Right now, can't we think for the time being on those lines, that can I collaborate with the doctors? Look, this is what is their requirement, right? Because let me tell you, I am a brand by itself, right? In the industry, I mean, I launched one basal insulin in 2003. I mean, still people recognize me with that. So I'm a brand by itself. So when I'm going and interacting with the doctor in order to help him, I mean, don't you think even if I don't have to mention the makers of this and that, doctors will recognize that? One. Now, when it comes to deep customer insights, as I've said, everything you have to take into consideration and then try to arrive at the solutions. Now, again, I don't want to touch upon solution part, but then fact of the matter is there are few facets which you have to bring in whenever you are thinking about solutions, like innovation, for instance. Now, for most of the marketers, this is a big challenge. I mean, we all always talk about innovation, but pardon me from saying this, and with due regards and respect to all the pharma marketers, I want to make, because part of my life I have spent in sales, and I was in marketing for say one year only. I mean, I have seen most of the pharma companies, they are not able to think beyond KOL, KBL, group 1, group 2 doctors, symposiums, round tables, square table meetings. These are the type of activities what we have been doing. I mean, there are very few cutting edge strategies what I have seen in the pharma industry. So what are the innovations we are trying to bring in? Can't we try to bring in some innovative strategies by way of which we can address that? I have seen in one of the companies when I was working with, with an American multinational, there they were having hepatitis B vaccine. There they came out with some very innovative strategy where they had collaborated with a bank, they had collaborated with the government, they had provided some sort of EMIs for the patients because the cost of the treatment was expensive, and that was the real innovation to me. So can't we think something new which is very innovative by way of which we are able to address the patient needs? And there, of course, I must say your digital innovation is going to be the big enabler, and that is what most of the organizations, they've started thinking about it. One. Second is the empathy. I mean, when you are thinking about patient, you as a company have got to be empathetic. I mean, I can share with you that when the empathy was not there, some of the big brands, they have simply gone into oblivion. And one example I can give you, I mean, there was one, C4 Taxi, big brand. Of course, there are a lot of people from Alcom here. I was promoting that, and that was the time it used to cost 156 rupees. I remember that, 1 gram vial, right? Vistapen was costing just 4 rupees that time. And, this I'm talking about 88. Now, 88 means 156 will be somewhere akin to some 3,000 rupees right now, right? Or 2,500 to 3,000 rupees right now. Now, we were ruling. For 3-4 years, we ruled. And then Alchem came and they swept the market, completely swept the market. And now ultimately that product, I think that company had sold to some other organization because they could not market that. They could not reduce the price. So when this is the case, when the empathy was not there and when there was an alternative, and this is the same thing is happening to many patented products also. You come out, you enjoy, no doubt about it. I mean, you spend a lot of money on research and development, no doubt about it. But how long? 10 years, 15 years? And then when the alternatives are there, suddenly you find that you are not able to sell the product because you have not been able to build that patient connect during this period. So that's something which I would like to say. Empathy is also something which you have to bring in as a marketeer in your thinking. It has to be a completely integrative thinking. I mean, you have to think from all the facets. What are the ways in which I can touch upon this patient and I can give them that customer delight to this patient? Optimism is again very important thing, especially when the sentiments are down. As a marketer, I've got to be optimistic that, look, I can still surmount this problem. Experimentation is required. And of course, it has to be a very, very collaborative effort. I mean, we are working in an arena where collaboration is very much required. So even if I'm a marketing manager, I have to deal with the IT person, I have to deal with medical person, and until and unless I am able to collaborate with everyone, and let me tell you, there's no positional power. You may be a marketing head, but when you are dealing with a medical guy, He's not reporting to you, right? So your influencing skills, they are going to be of tremendous importance. If you are not able to do so, you will struggle. You will struggle. You will not be able to, rope in all the people. And this I'm telling you from my experience, right? So that's the reason I'm saying you have to bring in that, influencing skills to get in. So, collaboration is one way by which you can succeed. So that's another thing. Having done the deep insight, the next challenge which a marketer is going to face, how you are going to create the value. Co-creation of the value is something which again is very important. Now, if you want to co-create the value, your relationships, they go a long way, and what are the values you are going to offer? And here, I want to give one, glimpse of that, what I'm trying to highlight. The glimpse is that suppose I am a diabetic person. I mean, why I'm giving you a diabetes, I can also give you from cancer because that's the one portfolio what I'm handling right now. But diabetes, because in chronic diseases, I mean, this works very well. So there's a diabetic person in the center, in the fulcrum. Now, what I as a diabetic person want, and again, I'm saying I'm also working in a pharma company, say for instance, I'm representing that also. What am I expecting? I'm a 60 plus, which I am actually. I'm a 60 plus diabetic person. I don't want to go to the doctor because I'm scared that if I step out and in case, God forbid, if I get, COVID, then my chances of survival will be little less. I don't want to go to that doctor's clinic also because there also again some 15, 20 patients are waiting. So I don't know what will be the, so there is some amount of inertia. I don't want to go there. Now I'm also donning the hat of a marketeer. So can I, go and talk to this doctor that, look, Dr. Saab, I will provide you some platform, telemedicine platform by way of which you can at least, bridge this gap. Because studies are there that if the patients, they are regularly visiting the doctor, the treatment outcomes are better as compared to those who are not regularly visiting the doctor. That is there. Doctor's point of view also, he is worried that, look, my patients, they're not coming in. And he is worried about the treatment outcomes, that if the patients, they are not doing well, then of course there's a problem. So he also is worried from this point of view, that patient also doesn't want to go. So here I pitch in as a company person. I say, I will facilitate this interaction. That's one. Secondly, when I was going physically, I was carrying all the files, etc. Right? Now I'm not carrying that file. Now, in case the doctor's clinic is fully equipped, then my entire thing will be focused that how can I provide some support by way of which some technician can come, collect the blood and, and get the reports. Otherwise, in case they don't have any such paraphernalia, maybe through, some lab arrangements, I should make in such a manner that the lab person comes here, gets the blood taken, fasting and whatever it is, gets the report, gets the test done, and this report is uploaded in the cloud server. And this doctor is also connected to this, the lab is also connected to this. So when I am talking to the patient, doctor, the doctor puts my enrollment and he sees all my records, for last say 6 months, how am I progressing? So that's one. Then this doctor is also connected through some e-pharmacies, right? So when he prescribes, I mean, this prescription goes there and e-pharmacies actually completes the loop of this. And as far as the counseling part is concerned, the diet counseling and other psychological counseling, again, I provide something. Now here I want to say one thing. I have seen organizations doing this, but I have seen organizations telling that, look, only for those patients where you are prescribing my products, we will provide that. Can't we be magnanimous? I mean, I'm not saying you have to do with every doctor. I mean, Pareto's law says 20%. I'm saying even if you do with 10% doctors, right? If this type of collaboration is there, I'm telling you, I mean, budgets, you don't have to bother about it. And I'm not saying anywhere my, right now scientific things getting discussed. I'm not saying that because, I mean, enough scientific things have been discussed in past also. Until there is some really breakthrough thing which is coming up, then of course you can organize this thing. But otherwise, you by yourself, you are a brand when you are doing all these things, right? So that's something which I would like to highlight. So I have said 3-4 things. Market dynamics are changing. Trust deficit is there, deep customer insights, then co-creation of the value. Then of course, digitalization is the great enabler in this present situation. The very fact that we are all connected in far-flung areas right now, it is through this digitalization. And COVID has done one good thing. Of course, Sandeep Da will talk about it, the opportunities. One good thing is that the adoption of this digital medium, even by doctors and the pharma industry, that has accelerated tremendously. And that is going to facilitate many other things. Artificial intelligence and so many other things are there which will help you, of course, in your taking care of this. So the challenge from the marketing point of view is how you are going to ensure the adoption of this by everyone, right? So that's one thing, and it's going to be a great enabler for that. I personally feel the type of prevailing situation which is there, there's going to be some pressure on the pricing, right? Fact of the matter is, a lot of businesses, they are not flourishing, people are not earning, salaries have actually come down. So in this scenario, if I have got a choice where the quality is also there and economy is also there, I will definitely go for that sort of brands, because here right now the patients also have got a choice to select which brand they want to take. So pricing, there's going to be some pressure on the pricing. Channel management is again a big challenge for everyone in this pandemic. And as a marketer, therefore, I have to give the very accurate rolling sales plan to the channel people. And I know the biggest challenge when you have to give the rolling sales plan to the channel is because you are not also very certain what is going to be the scenario next month. I mean, suddenly you have given this rolling sales plan for 3 months and there is going to be a lockdown. So that's the challenge which most of the marketers, they are going to face right now. Some of the other challenges to my mind is, digital trust. Now, we have talked about digitalization. We have talked about digital is going to be the great enabler. But let me tell you, the biggest fear which a clinician is going to have is how my data is going to be safe. How this data, when you are talking about cloud server, you are talking about, the lab, how am I going to ensure that the data, what I'm going to give, it is going to remain with me only, and people will not, breach this data. So that is again one big challenge. If you want to go digital, I mean, you have to somehow give this, again, it boils down to the same trust. You have
Yes.
to build in that trust that, look, my data is going to be safe and secured, and nobody is going to breach that data. So that's another thing.
True.
And of course, adoption to digital is going to be the order of the day. So these are some
Yes.
of the strategic challenges, and
Great.
little bit about just 1 minute. I'll take Varmaji. I think
Yes.
I'm exceeding the time. 1 minute. When it comes to tactical things, you have to ensure that the field force, I'm including area managers, they also embrace everything, right? They also embrace, first of all, they should know how to talk. Soft skills, nobody teaches actually these days life skills. And life skills, to my mind, they are very important if you want to converse with the customers in a very matured way, right? Conversational anchors also a marketing guy must provide to these field force. On what basis, how they can talk. And these are all practical tips which I'm suggesting, but they are very important, because all the high funder things, if people at the grassroots level are not able to implement that, it remains only in the head offices only. It does not percolate it down into the field. Digital adoption by everyone, and of course, lastly, emotional connect. I mean, I can cite so many examples where I've found out that those marketing managers, those who were able to establish the emotional connect with the field force, the field force used to especially take liking for that product. And once that happens, you are likely to be successful. So these are some of my thoughts. Over to
Thank you.
Varmaji.
Thank you very much, sir. I think it was very comprehensive and got a lot of insights. Just to summarize before going to the next speaker. So I will summarize in few minutes. So you talked about the major challenges of the restoring trust and product, changing from product centricity to patient centricity and customer centricity, and innovation in digitalization, empathy in marketing, collaboration in skills, including influencing, and the co-creation of value, adoption of digitalization for both field customers as well as to the head office, and the pressure on pricing because of the current situation, and the safety on data, because everything is going on the cloud and going on these websites. What is the how we are going to trust which sites, and the pressure will be there on the everybody, including doctors, including patients, and everybody. And mostly, like you spoken about, there are two skills which are really required at this present moment for the industry, especially the field. They should be trained on life skills apart from the soft skills, and the emotional connect, because they should be emotionally intelligent. That's coming big way now in the industry. Yeah, thank you very much, sir. Now we will go to the next speaker. So to introduce next speaker, I request our co-panelist to introduce, or Arpan will introduce. Yes, Arpan.
Thank you. Thank you so much, ICS, sir. Yes. Thank you so much, ICS, sir. So once again, good morning. So our next speaker is Mr. Sandeep De, extremely dynamic person who doesn't require any introduction. He's a very familiar figure in the pharmaceutical industry. Mr. Sandeep started his career in Dr. Reddy's laboratories as a medical representative in Kolkata. He has worked in different companies throughout his tenure and has worked in different areas as far as the segments and specialties are concerned. Currently, he is working in Alkem, and he is heading the division for hospital and critical care, and he is here for the last 4 years. He is a wonderful speaker and has been present in LPC in other discussions also. So we sincerely hope that today also he will give us a lot of insight during his deliberations on LPC-60. So please join hands in welcoming Mr. Sandeep De. Sandeep sir, it's over to you.
Thank you, Arpan. Thank you. Good morning once again, and good morning the audience. Thank you, my erstwhile speaker, Mr. Pankaj, as well. I believe Mr. Pankaj has covered a lot of. Just give me 1 minute. Yeah, sorry. So Mr. Pankaj has covered a lot of challenges which we are facing in the pandemic and overall in the industry itself. That gives a lot of insights. So my topic is to talk about the opportunities we have seen during these pandemics, and that is purely from the marketing point of view. So what are the marketing opportunities from a marketing guy or marketing managers to the product manager, the product department? From the marketing point of view, what are the challenges? What are the opportunities we have seen, and specifically give you some pointers. And visible, or
Yeah, it's visible. It's
hello?
visible. Yeah, it's visible.
Yeah. Okay. Yeah, thank you. So as I told that I'm talking about the marketing opportunities. So before going to the pandemic and the marketing opportunities, though my next slide will talk about the crisis and the opportunities, and the slide will be a little funny because during this pandemic, all our fear psychosis, which we have started with a country which has got a huge trust deficit today in the world. So though the comments is from John Kennedy, but it is this is a Chinese word. In Chinese, when they write, when Chinese writes crisis, this crisis is composed of two characters. One character is the danger, and another character represents the opportunity. So it's a fantastic teaser, you can say, to start these topics on opportunities, on marketing opportunities. And coincidentally, our crisis has started or originated from the country which is using crisis to define danger and opportunities. Okay. Now coming back straightly to our country and the marketing opportunities we have seen, I'll just show in my next slide a small newspaper cutting, which came around 3 days back in Times of India. I believe most of you have gone through it. So, which talks about Indians spend 15,000 crores on immunity boosters in a year. And if you think about the last year market size, the IPL, it was around 140,000 crores. And within 13 months, that 140,000 crores has come to 169 crores in May. So which depicts a significant double-digit growth after so long years in Indian pharma industry. And if you think about that growth of around 29 crores, the last 1 year has been added. I'll not tell added. Out of 15,000 crores, around 10,000 crores has been added from the immunity boosters only. Apart from that, there are some other products which you have experienced, like antivirals, favipiravir, remdesivir, kind of product also added in last couple of months. Even liposomal amphotericin B because of the mucormycosis and all. So these are the products as added. So what I'm trying to say, it's not the product specific. It's the industry when we were crippling in the last year beginning, when the first wave came and industry was crippling. Only initial month, chronic was showing up a little better growth because of the panic buying. My next speaker, Somendu, is there, who is my colleague in Alchem. He is from chronic segment. I believe he will be aligned with that thought. The first wave, when the pandemic begins, there was a huge surge in the chronic segment because of panic buying. The people were not ready, and people are not understanding that what is lockdown and how many days they will be out of stocks, out of medicines. So they had a panic buying. So 2-3 months was huge growth on the chronic segment. But when second wave came in this year, and in the second wave, we have not seen that kind of panic buying in chronic. Rather, acute has outperformed the chronic and the industry. So what I'm trying to say from this slide is the significant and unprecedented growth has happened in Indian pharma industry during this pandemic, which really makes us see the kind of opportunity was there behind this pandemic. Now, coming to our overall understanding from our childhood is that the business growth lever in pharmaceuticals or per se in other businesses also, depending upon 4 basic levers. So, which are people, products, process, and customers. Now, in my subsequent slides, I will just try to give you some pointers or try to share my experience of what I have seen in last 15 months or 13 months, 14 months, how these levers, there is a change observed in these levers, and what is the benefit of that, how it has impacted the business, and what should be our learning out of this. If we come to the people, we have seen that organizational empathy, most of the organizations, I will not name a few or handful organizations who has not shown that empathy, which Pankaj ji has covered, that empathy is one of the major things throughout the business. It's not because of the pandemic, but then it was not being observed so significantly. Till then, there was a crisis. Now we have seen, because of the organizational empathy, the loyalty of the people has increased, and the loyalty of the people. When the people loyalty has increased, I can share my experience of my teams. When there was the first wave, when people were completely insecure, they were not able to sell, and they were thinking that whether the salary will be coming or not. I am grateful to my management, I am grateful to my leadership that we could have given them that surety that please don't worry, we are there. We made their family over virtuals. We told we are there, we are all a family. And I can tell you, when there was a little curbs has relaxed in the month of August 2020, the people has come out, and then people have expressed that as fast as I will come out, I can do some sales, I can justify my absence in the industry, in the field, I can pay back to the company. So that's great. For me, it is something great. And And I believe all of you have seen the attrition rate has come down significantly during this period. Many people may say in a different way that that's because the opportunity was less and the security was a question, so people have not changed. But I don't feel so. I feel that opportunity was always there, even today it is there. But then people felt the kind of empathy organization has shown to be there to support them in the good times. During that lockdown period, the time utilization has been done in such a way that competency development of the people has significantly increased. And that is the impact we have seen. My future recommendations will be, or I would like to take this opportunity in future also, using the virtual platform, even in the normal time, why not to continue that competency development programs. The relationship utilizations, every hierarchy has tried their best to strengthen their customer connect, whoever their core customer, to be there even in the virtual platform, even over phone, WhatsApp, mails, to make that relationship utilized as much as possible. A very, very strong point, which I personally also felt, and I believe a lot of people in the world or in the industry has felt the value of life. The kind of self-realization, the kind of self-actualizations people have gone through this period. For my own self, I can give one example. When in earlier days, in normal days, very often we were throwing out dried vegetables, some carrots, some beans. We were just throwing out to the dustbin from our refrigerator. The period has gone when I was searching the refrigerator if I get some sukha carrot, some dry carrots to make some sabji. So that is the kind of, the days has gone, which has given us the kind of self-actualization, the self-realization, the value of every small thing in life. So I personally believe that is a great transformation happened in the human race. Yeah, another thing which has been seen, that the world was going, or at least my surroundings, I have seen the people were going towards the selfishness. I'm not telling that selfishness has gone, but this pandemic probably, because of the fear psychosis, that some kind of selflessness has come out in this, which is a very positive sign in my view regarding this pandemic. So this is the kind of people I have observed the impact, and I believe this impact is going to happen. So these are the opportunities would not have come unless the pandemic would have been there. Coming to products, I have already given some example of the products in my second slides rather. And all of you who are there in the marketing and who are there in the industry, they know the kind of products has flourished. One is antivirals, one is antibiotics or anti-infectives, one is supplements, nutrients, zinc, minerals, vitamins. So these are the kind of product has been done extremely well. Yeah, there are short-term opportunities, there are long-term opportunities. If I want to give my observations, if somebody has taken the short-term opportunities, so they must have gone for the remdesivir, though there was a limitation because of the Gilead license issue. But then favipiravir, there was no limitation. So we have seen 40 or 50 odd companies has launched favipiravir. Favipiravir in a 1 year time has made a market less than 1 year. This has been launched in July last year, June 20th, exactly June 20th, June last year, Glenmark has launched Favipiravir. So today is 20th June, 1 year. And the 1 year time, the product has been made around 1,300 crores. So this is unbelievable. So a lot of companies have taken the short-term opportunities. But then there are long-term opportunities. There are people who have started working on post-COVID complications, drugs on post-COVID complications, or I am talking about the marketing innovations in my next points. So there are a lot of marketing innovations which is equally been treated as well as R&D innovations, where they have repositioned their product in a different kind of treatment. The post-COVID treatment have become long COVID, or post-COVID treatment become a kind of real opportunities. Even I can name a few kind of opportunities. Still, I'm working on it. You must have seen there's a news in the around 15-20 days back in that IIT Hyderabad. There's two scientists, Dr. Chandrasekhar Sharma and his team. They have developed a nanotechnology. Using nanotechnology, they have developed a product which is a oral liposomal oral amphotericin B, which is as equivalent or as effective to liposomal amphotericin B. And I personally had a 2 round of meetings with them because they need to do some kind of CT preclinical clinical trials. So we are in talk with them. So that will give a different kind of game changer in the antifungal treatment, because when a liposomal amphotericin B injections, per injections is costing around 6,500 to 7,000 rupees to the patient. So they are expecting this tablet will be costing around 200 to 250 rupees per tablet. So that is the kind of opportunities is there. So it is not only the pharma industry, the associated industries or associated scholars in the industry, they have also started working on the opportunities given. So there's a lot of long-term opportunities I can see which come out from this pandemic. A lot of thought process has changed. Repurposing of drugs. You've seen a lot of drugs. Ivermectin was the additional sales of ivermectin was around 150 crores in this 1 year time. This is a small product I'm talking about. The repurposing of drugs. The Zydus has recently launched one product called Vilofin, which was already there. It's an interferon alpha 2B. But then they have repurposed this drug. So there is a lot of companies has started working on the repurposing of the drug. And this repurposing of drug will keep on continuing. From not only from the antiviral point of view, it's from the more to the immunity booster point of view or the immunomodulator point of view, which can be repurposed and used not only in COVID, but beyond the COVID also in other complications. Yeah, there is a tremendous changes and significant impact on the processes. So I have just captured a couple of things. I could have captured 10 other points, but then the major points which I have seen, the process to connect, there's the enormous innovations in the execution. So one of the major innovations and executions in the process of the entire pharma business, which Sobendu, my next speaker, will be talking about regarding customer connect in digital. So this is not only for the external customers, even for the internal customers. We have tried to be there with our teams, that we have tried to talk to our representatives, or area managers, regional managers, general managers, sales managers, our entire team, PMTs. So all the internal stakeholders, the other departments, support teams. So there was a clear, stringent system process has been built, and which is still going on. Even if 50-60% we have come back to the normal, people are going to the field instead of 10 or 11 call average, they're coming back with 6, 7, 8 call average. But still, those connect has not been lost. This is continuously going. So I believe that is a fantastic opportunity has been evolved in this pandemic. The review process in different hierarchy that become much stringent, much regular. Earlier, most of the pharmaceutical company was doing a monthly review. Now the monthly review concept has come to weekly review. For some hierarchy, it may be bi-weekly review. So that became more stringent, more result-oriented, and cost-effective. Collaboration with the different departments, and that brings out our best solutions. Earlier, the way Pankaj was talking about, that you may be the marketing head, but then when you are going to a medical guy, he is not reporting to you. So he is not going to listen to you. He will have his own priority. He will have his own time. But I have seen this 13-14 months has given a lot of camaraderie. And so many times we interacted in last 13-14 months with different departments. I believe in last 4 years I have not interacted so many times. The kind of interaction we had with the different departments. And there was a need basically. When we talk to PMT, our strategy team or BD team, we go for brainstorming. There are a lot of new ideas came, a lot of innovation, marketing innovations came, So these are all brings out a lot of opportunities and a lot of impact in the business. Supply chain. Earlier supply chain was going with some kind of formulas. Now supply chain also getting what Pankaj was saying. So you must have given a forecast. Now that forecast do not have any relevance unless you are maintaining that forecast and you do not know what is going to happen in the market. You might be landing with 30% of your sales of your forecast because of the circumstances, or you might be going to 200% of your forecast because of the circumstances of the market for some SKUs or for some products. So that is a real challenge for the supply chain, for the procurement, in maintaining inventory. So they also have evolved a lot of system, process, innovative ideas, repeated interactions with business teams. So there's a huge change. The procurement innovations. Because of this pandemic, there was a lot of price rise in the API, non-availability of the APIs. So the factories, the third-party manufacturing products, the plant is closed because of the workers got COVID. But the product has to be finished goods has to be made it available for the business. So the moment they got challenges, there is a lot of innovations happened. There are a lot of new opportunities has been come. Earlier, majority of the big companies they have a protocol of working with one vendor for one product. Like if there is third-party manufacturing product, so generally they go with the one vendor. Now the AVD, the alternative vendor development, become a very regular course in the procurement, because there is no other way. If you have a business requirement of around 1 lakh strips a month, and your existing vendor is not able to give you more than 30,000 or 40,000 strips or units, so you do not have any other way but to go to another vendor and develop the alternative vendor in a wire-footing basis and to supply the demand created by your team. There was a cash flow. There was challenges in the cash flow because of the less sales in the beginning of the last year. So finance innovation was how to maintain the cash flow, how to ensure that the people get their salary remuneration right time without any hiccups. The vendors get payment in the right time. So there was a real challenge, and they made their finance innovations. They have involved the financial institution, banks, and they have achieved their targets to bring the cash flow in the right time. The L&D engagement for competency development, which I have already mentioned in one of the slides, that has been significantly given the opportunity for the people to grow in terms of competencies, and that is definitely impacting the business. The HR innovation, the major challenge was how to ensure the uninterrupted workflow being in the work from home. So that is a fantastic. I'm not talking about Alchem, I'm talking about the industry. Because the industry has grown, pharma industry has grown significantly, that simply means that every function has given their best, even in the pandemic. So that is the kind of process I have seen, that there is a lot of opportunities. People have seen, innovation has been seen, and big business impact has been seen, which definitely will keep on flowing in the coming time. It is really difficult to meet as conventional approach, in-person meeting, physical meeting. So new way of connect has been built on. So Mendu will cover that. Significantly, KOL and KVL engagement has been increased by webinar. Yeah, so some of you may be a little skeptical in this, because I can tell that recent webinars has not got that much of audience. That is maybe because of the overflow of webinars and the overcrowding of the webinars. And simultaneously, the things are getting normal. People are going to the field. They're getting some physical meetings. That may be another reason. But I can tell that is why I specifically wrote KOLs and KVLs, not because of the audience. So KOL and KVL engagement has become much more easier because of these webinars. Yeah, there was a revolution in the knowledge dissemination initiative. The customer also acknowledges the efforts and moral supports given to them. Pankaj also touched that. The need of the customer has changed. Now the need is not a materialistic. Now the need is more emotional. I personally have seen, because I hate the entire hospital business of the healthcare, and our major woman is the hospital working. I personally have started working from the September last year in the field. Till March 25th, I worked profusely in different cities. April, May, I could not, but then again, June, I have started. Even last week, I was there in the field. Last week, I was there in the field. So I have seen the approach of the customer has changed. And because of this, a lot of companies have made work from home. Even today, the people who has taken the initiative to go a little early, who have started working from April, they have acknowledged those people in a much better way and identified those people to give them the supports. So ultimately, at the end of the day, that emotional quotient with the human to human emotional quotient has been an opportunity. It is an opportunity, and it will be an opportunity. So this is the 4 levers I've completed. I will just touch base 2 more important things, which I believe I have seen from my domain very significantly, and I believe I should share to the audience, because that is going to impact the future pharma marketing in a much significant way. The hospitals marketing point of view, there is a huge paradigm shift. Earlier, a lot of companies were not in the hospital business. The companies who are in hospital business were not having a very significant focus on the hospital business because of the total size of the business. Maybe one of the reasons, because when the total industry was 140,000 crores, the hospital business was around 16,000 crores, maybe around 10% or 11% of the total business, and that includes the nursing homes, hospitals of every small territory. So you cannot keep such a big field force to cover all those nursing home hospitals and to cover only 11% of the market. So that may be one of the point till last year. But then, from the marketing point of view, when we see the hospital business, earlier we were doing the business potential mapping. That the covered hospitals business potential mapping. Now, initially of the pandemic, we gone from business potential mapping to bed mapping. That how many beds are there? Number of ICU beds. We were monitoring number of ICU beds being in the critical care business. But now the paradigm has shifted from ICU beds to occupancy percentage. There may be a hospital where the ICU bed is 100, but the occupancy is 50%. But there may be a hospital where ICU bed is 80, but the occupancy is 100%. So obviously that focus will be on the second hospital rather than the first hospital. So now the micro level, what I'm trying to say is the marketing team or the marketing intent has been changed dramatically from business potential to the occupancy percentage today. From the hospital perspective, there is so many loads. There was no bed during this pandemic. There was so many SKUs they have to handle, so many vendors they have to handle. So they have changed their approach from the multiple vendors to the vendor consolidations. Now, if earlier a hospital was buying 2,000 SKUs a month, and they were having around 500 vendors to supply those 2,000 SKUs, now they are consolidating in such a way that can we get the 2,000 SKUs from 100 vendors? And they're choosing those 100 vendors in such a way that those 2,000 SKUs can be supplied. So more than a product selling to the hospital, it has gone to the solution selling to the hospital, and the basket approach has come into. I believe ICS, Mr. ICS is there, and who has a hand-on experience of serving the hospitals. I believe he can sum up once I'm done with. So to align to this statement. And in relation to that vendor consolidation and the basket approach solution, apart from the doctors in the hospitals, the relationship with the CIPs, means the procurement heads, the commercially important persons, means the procurement heads, the director of the hospitals, who takes the key decision makers for buying the product. has significantly increased, and there is a huge opportunity for all the companies who are not in hospital business, who are in hospital business. There's a huge opportunity because hospital is going to be increased, hospital rate is going to be increased because there is a lot of private equity investment, there is a lot of venture capitalist investment, there's a lot of new greenfield projects, there's a lot of acquisitions you have seen, and the main reason is majority two. One is the increasing in the insurance awareness of the people and getting the entire treatment from the OPD to the ICU or ECMO under one roof. So that is the kind of opportunity marketing people attending this program or the session, and even the students, MBA students or the pharmacology students who are aspiring to be there in pharma marketing tomorrow should keep in mind that future lies in hospital business. Last but not the least, I believe this is one of the forthcoming forthcoming projects for the marketing people is how to handle insurance and tie up with the insurance. This pandemic has shown a lot of very high-end product or injectables to be sold, high kind of hospital billing, which cannot be met up by common people out of their pocket expenses. So this need insurance support. So that may be one of the tool to get the patient centricity, which I will quote Mr. Pankaj once again, which was talking about the patient centricity. So maybe I personally believe the marketing team should look into it, tie up with different insurance companies, and see that how they can make a bridge between the patient and the hospitals and or the doctors and insurance companies to give to create a win-win situations for all of them, for the insurance companies to get more traffic, to get hospitals more patients without any hiccups under insurance, and to get the patient that kind of assurance of getting the better treatment in the hospitals without their pocket expenses. So that I believe that is going to be a game changer if any marketing team or marketing people make projects or start taking the initiative to have a tie-up. So can we? That is the way. Can we think a little beyond behind the literal insurance coverage, which it means. With that, I believe I'm done with my talk. Thank you once again. Thank you for your patience hearing. I am there after completing the Somendu speech. If you have any questions, audience have any questions to address this. Thank you once again. Thank you very much. Thanks LPC. Thanks my co-speaker, panelist, and the audience. Thank you.
Thank you so much, Sandeep ji. If you can answer, actually you had hit at the bullseye. The first statement which you had given about the interpretation, Chinese interpretation on this crisis, it is danger as well as opportunity. And from there onward, the way you had taken the flow of the presentation, it was indeed a very detailed and very comprehensive way. I'll be talking about few of the things which I'll be summarizing about your presentation. A vast knowledge in a couple of words, it is very difficult, but I'll try. I'll be sharing that. The way the Indian market during this pandemic had moved from 1,40,000 to 1,69,000, it is really enormous. And actually, in today's world, if business numbers are supporting all the efforts which are there, everybody will be encouraged, which you had touched upon. The second, which you had talked about, which we have been talking more of, but the way you had elaborated, it has blessed all of us, the growth levers, people, product, process, and customers. And in each aspect, the way you had touched, like in people, empathy is one of the things which has been very promising nowadays. And empathy you had touched, and you had given cited an example which was really good. And at the same time, the fear psychosis. Nobody is able to interpret what is going to happen. Based on certain data calculation, they are interpreting that this may happen, and everybody is in fear. So the way you are handling your team, the way you are handling your people as organized, it matters a lot to him. Second, which we talked about the product, there should be some short-term goal, there should be some long-term goal. We should not be biased into the situation that we should be failing that. And you had talked about the way innovation has to be worked out along with the R&D, along with the team, understanding the patient requirement from the doctor in this limited, in this pandemic time. And if we are able to touch some innovation to our product, then definitely it will click, and which we had already seen about Feviflu as a brand. Then we had talked about, you had told about the process. Yes, the process is more important in today's date. How you are having a convincing skill, or you are able to collaborate with the inter-department, that matters a lot. And you had jotted down all those 9, 10 departments which need to go hand in hand, then only things will be successful. It's not going to be a one department which is going to drive, but it is all the department. If the procurement team is not able to procure, then the salesman will not be able to sell the product. If the L&D team is not going to build the capability of the team, then in this pandemic, when the salesperson is not having sufficient time, he will not be able to hit the bullseye in the doctor's clinic on those 30 seconds. You had touched about the brainstorming session. I'm just will be adding one, the 24-48 rule, which has been talk of the town nowadays. So sitting in the AC chamber in 24 degrees centigrade and not thinking about 48 degrees centigrade, what the salesperson is going to talk, it is not going to happen. So brainstorming is utmost required, and the 24-48 rule, which you had very rightly touched about the process, which was very promising. At the customer level, once again, you had talked about the difficult to meet. So are we going to have a communication which I was having for last 15 years? The way I was handling a detailing aid or a visual aid, the same will not be fulfilling the purpose. And let me put in this way, that what had happened in digital in last 15 years in the pharma arena, it has happened, it has quadrupled in last 1.5 years. So this is the opportunity which you had touched upon, and it was really good. And doctors are having a hunger for knowledge. The way you had talked about the life has been, we had all valued life. The same, a doctor is also a human being. He has also valued life, and he is now having a hunger towards knowledge. And as a pharma person, if we are able to give those content, then definitely it will be helpful. And also you had shown the broader view about the hospital management and the hospital working and insurance, which is going to uh, take us into the sky. You had touched, I'm sure the way you had presented, I was not able to correlate a lot of things, but few of the things which I had summarized will be helpful to all of our listeners who had joined us today. Thank you so much, Sandeep ji, for the detailed talk. Yeah, we can go to the next
Thank you,
speaker.
sir.
Yeah,
My pleasure. My pleasure. Yeah, thank you.
we can go to the next speaker then. Uh,
Yes. Amit will introduce the next
yeah,
speaker. Yeah, Amit, over to you.
Thank you, ICS sir, for inviting me. So to take this opportunity to invite Shomendu sir, I just want to tell some words about him. So he's a senior professional, more than 18 years of experience in pharma industry. He has grown from the grassroots to today. He is a BU head. He has moved various companies. He has started from Cipla, and then he has moved to Abbott as a national sales manager. He has today moved on to BU head. He's a true inspiration of for many, right? So the means for his overall qualification goes, he is a IIM graduate on diploma in marketing management and various portfolios. I do not want to bore you with all the things, but now with his entire visionary thoughts, I would now like to give this opportunity to Mr. Shumendu sir to discuss about his topic. So the phygital era, the physical plus digital, is something which is bothering each one of the marketing guys, right? They have to bite this bullet of physical as well as digital. This pandemic has brought. So in this era, meeting customers and being meaningful becomes very important. And he will touch base those pointers, how you can actually meet the customers as well as use this physical and digital means to connect to them. So I welcome Shomendu sir to take up this talk.
Yeah, thanks, Amit, and thanks LPC for inviting me for a great platform and give me the opportunity to talk about which we am working on daily basis nowadays. So I think Pankaj ji and Sandipta has already, talk about the, connections between why we require, physical era and sometimes we require the physical connection is important, but in this after the pandemic situation, it is not possible to connect all the customer. So now the challenge is how to make a customer connect, because we are in an industry, our touch point is very important. It's not like that we are FMCG or banking, we will give some ad and in a different digital media, and it will work. So we are absolutely ethical business, and this is morely on prescription-driven business, where we have to create a lot of touch point with definitely we cannot reach to them. So how to increase our reach? There are a lot of changes in the market. Even there is a lot of changes in the mindset of the customer also. There is a lot of mindset for the patient also, because we have to do something for the patient centric. So let's see we what we can go ahead in this era. uh, Amit, just can you confirm the slides are visible now, right?
Yeah, yeah, yeah.
Yes, visible.
Thanks. So that I try to pointing uh, out in this era what we can do about. So phygital, basically, if you see, it's a physical and digital, more movement. Because it last year when pandemic started, we are not able to, see the or meet the customer, especially the sales force, not able to reach the customer. So what marketers start doing a lot of, digital campaigns, WhatsApp messages, WhatsApp stickers, WhatsApp videos. They start to preparing. So finally, to the customer, it's become a digital fatigue. But still, customers are not meeting properly. We are not able to meet them regular basis. Somehow we are meeting the customer outside of the hospital, even in a common places like parking place. Even they are in a different methodology people have now adapted. Somebody is meeting in the breakfast, somebody is meeting for the dinner, but something, there are a lot of things has been changed. If I want to summarize these things in a nutshell, so that's call about we have to meet digitally but with the physical presence. So that makes a more right words, the physical. So that's a challenge of the marketeers today, how to make it the process most robust so that uh, execution from the field force can reach up to a one excellence level. That's a challenge which we want to touch. And my all viewers, I want to say that this is not going to be a normal like what we are doing earlier. It is going to something which has been in a changing environment, and it will be remain up to more than 5 years, because that is I can predict from my understanding from the market and regular feedback. If you see it in a customer mind also, they have also adopted a lot of process to meet with you guys and meet the all the medical representative in the seniors also in different methodology. So it's important that we have already entered into the digital era, and we have to be equipped ourselves for the betterment of the coming marketing objective. Now, if you see in today's scenario, there are a lot of surveys are there. I don't want to go into the more details because it will take a lot of times. But 43% ACP restricting entry the pharma profession. Suppose for an MCL size of 100 people and 43 customers are not meeting. So the challenges are very high for the marketeers. How to make a reach to the rest of the customer? Maybe we're meeting only 50%. That 50% when we're talking about, that is not in regular basis right frequency. We talk about the process of of visit frequency for core customer, super core customer, or 3 time, 2 time. But whatever we are talking in our head office level, but to implement it in the down the ground level, it's very, very, very tough nowadays scenario. And this is shifted. Even doctors are today want to meet with you over Facebook. They want to do the digital call. They want to meet the customer with the digital platform. Earlier, there are no concept of telemedicine, or there is a no concept of meeting customer from head office side and to increase the reach customer base. So today it is possible because of that digital era, and which makes me more prominent to meet the customer. For an example, from earlier nobody is thinking for all the division heads meet the customers in a one shot. Now it's very much possible. They have to now, they don't have to fly to Hyderabad or Bangalore sitting at Bombay. They can interact with the customer. So that's the power we are having, and that's a mindset also we are having with the customer. If you see the number of ad boards, number of CME, number of RTMs has been increased. Why? Because this is the another platform to meet the customer regular basis. It is not in the one level, it is from the every level. The opportunity, the scope is more increasing. So what's is happening now? The traditional segment, which is based on traditional detailing, now it's a need based segment. It is segmentation has been totally changed. Otherwise it's only brand, so you have to promote your brand. But today you cannot only promote the brand or promote the product, it has to be add on values. Because today if you see in pharma, apart from the pharma market, so the most important thing, so refrigerator, when you're selling, you have a choices. When you are selling the all kind of AC, you have a choices. TV, you have a choices. But how your brand is differentiated? Your brand is differentiated because of your services. Now, in same thing in pharma marketing, the services are very important. It's no longer to be your brand and detailing on the brand. It's what are the additional services you are providing for your customer in terms of your patient centric approach, your helping to reach to the patient, helping customer to regularize the patient, and how you can actually help the customer to increase his patient base daily basis. Because in lockdown, doctors has also suffered a lot because they don't have any patient. Patients are reluctant to come there unless until they have a severe patient. There are few segments like have suffered a lot. So in that case, so service is very, very important, and this service is more in terms of digital. Generalized approach is no longer in the pharma industry. If you want to create your brand, it's all about the brand building. And if you want to create your brand and build up the brand, then your approach has to be very customer centric and identify the need. And then you need to be uh, build the overall need of the customer and the satisfaction level of the customer. And if you ask me, the solution are majorly will be based on the different digital platforms. So that is the more attractive platform today available. If I'm talking to a customer, what he wants to be. Earlier, everybody wants to reach to the audience or speakers, so or panelists by through one conference. Maybe for a particular segment, if I take an example of diabetology, there are national conference like RSSDI. Now a speaker can reach hardly 200 audience, and the panelists maybe 4 5. Today, because of different platform are virtual, the speaker is also reaching more than 4,000, 5,000. So touch point has been increased, touch point has been, changed. And there the scope of pharma industry to touch the speaker to make more, create a more service like that. And what a customer wants from the pharma industry, he wants is, what we were talking, what we were doing, to to reach as maximum number of doctors, so that his references, patient educations, patient benefits will be increased. Today I can tell you there are a lot of companies working and who has been created a lot of speaker in the pharma industry. Earlier they are not known for as speakers, so hidden potential has been, unlocked. And that's the opportunity, I can say, in digital era. So there are a lot of platforms are available in, to engage. There are a lot of bloggers are nowadays are coming. There are a lot of doctors are talking on Facebook for the on patient education, Twitter, Instagram, LinkedIn, uh, HubSpot. There are a lot of mail services, Interval and Mailchimp. These are the services are all there, and customers are using to reach the his patient level. And patients are now very much friendly to do the WhatsApp call or using different platform with the customer to reach the customer. Today, patients are also having a fear. So that's the opportunity. How much service we can give it to the customer, or to make sure that he can also come to reach to the patient. Today, if you see the doctor level also, they are also using different platforms, and from different platforms they can reach how many patients earlier was there, how many patients they are dealing with regular basis, how many brands they are using, what are the pharma companies they are using the brand. Now every data is available with the doctor. And this is the mindset. Doctors are no longer only treating the patient, they are also doing the analysis. There are a lot of apps are available in the market. I don't want to take the names, but at least as a marketeer, if I can tie up with the customer with the different app, different tools, and daily basis, you can do the follow up on that, so doctor can understand to reach with the patient. I was discussing with a few KOL in the for pharma industry. He said one thing make COVID is very positive ones. My reach is now more than 5,000. When I'm live or when I'm coming to talk to the audience or patient, my reach has been increased like anything, which I never thought. Second, I don't have to travel. Earlier, to do a meeting, my 3 working days are lost. Now, for a meeting, only it's required 2 hours. Now, doctors are also, aligned with these changes. Now, this is the opportunity how we can make their life more easier, how they can reach to patient, and we as a farmer people can reach to the customer more easily. That should be the main thought process of marketeer. So if you see the in a physical era, if you see the everything has been now changed. If you earlier banking, you don't need to go to bank, you no need to go to the retail shop, everything is available, just a click. You no need to go to school or colleges, but still they are running the school colleges, and people are more equipped with the uh, uh, different app. And pharma companies are also moving towards this digital era to connect the customer through different apps. There are a lot of apps are available. Through that, they are not only helping the doctors to make their patient education, they are also trying to connect with the customer. These apps are also helping the customer what customer is doing for the treatment, whether they are taking a regular basis, medicine or not, in what frequency they has to consult with the doctor. Earlier, there was no such connect. For an example, for a doctor level, when he has done one consultation and asked the patient to come after 3 months, you never know whether the patient will come You never know where is the patient, where is the data bank. But today, the digital era, when patient, done the online consultation or physical consultation with the doctor and enrolled in the app. So after 3 months, doctors also getting, reminder. Patients are also getting reminder. There are also apps out there where patients are getting regular reminder to take the medicine. So doctors are also assured that your patients has been taken care. Now, as a marketeers, we have to explore more number of such tools, more number of such inputs to the customer level. So the people not able to meet the customer properly, they can be or they can get some help from the marketing team to make their life more easier. So that's a way we should change ourselves in the coming marketing segment. So, but the most important thing, the human connection. In human connection is very, very important still now also. Doctors in apart from few segments still believe that they want to do the human touch. They want to have a human touch. It cannot be only over phone call. They want to see the patient properly. They want to examine the patient properly. They want to see what are the reports, and it is not possible even over phone. So, and whether in patient condition, they are not ready to come to meet the doctor. So regular follow up is very important. And that's why this virtual platform or is most important today's scenario. And this journey of virtual, last year it was not that much popular, but today everybody has understood that virtual connection with the customer, virtual connection with the patient, virtual connection with the pharma companies, all are very important. We cannot cover everything with physically. So we have to have some digital connection with a lot of physical exposures. Now, there are a lot of engagement programs which is running today's scenario for the doctor engagement program, like digital calls are becoming a norm. There are a lot of doctors are giving you the appointment slots to do the calls. So how much I'm equipped to it? I know some places people are reluctant to use, especially in MR level, they're reluctant to use the smartphones. But today scenario is changed. Organizations are giving tabs, and let's use it more as a tool, how you can connect with the customer more digitally, and regular basis a chat, a regular basis discussion. Your job will be monotonous if you only talk about the brands. But if you make it more discussion orientation through different webinars, Facebook Live, virtual conferences, it will be more easier to connect with the customer with a lot of virtual reality, as well as some artificial intelligence, or there are some tools like augmented reality. It will be help to connect your customer with a different, different era or different point of view. Today, always today, if you see, the customers want to meet us with some distance. Now, as a marketer, if you the best tools I have seen nowadays, the augmented reality is one of the best. When you show with your app or augmented reality folder, it is going to be more easier to connect with the customer. Teleconsultation platform, there are a lot of company, earlier one or two company, now there are a lot of companies are developing their teleconsultation platform, which is more popular in today's scenario to the doctor. So doctors want a solution, not only your product. Here the companies are not only discussing with their products, they are also providing the service to the doctor. Then there are a lot of clinic management tools are available, digital forums are available. In patient centric also, if you want to do the monitoring or diagnosis also, there are a lot of tools are available which can help the patient regular basis to do the diagnosis as well as connect with the customer. so that they can regular be in touch with the customer for the more follow-up. Now, if you see, there are QR-based patient education kiosks are available, patient education literatures are available. If patients want to touch point with the doctor, so doctor can provide them very good patient education material with a very personalized note. Now, this all are available through app. Doctors has nothing to do because it's our service for the marketeer. They will give the app. Doctor will just click, send all the details of the patient education material to the customer or to the patient, and with a personal note also, with the photograph of the doctor. What happened to the patient mind? So what Srivastavaji was talking as a patient, I am getting my satisfaction because my doctor in touch with me. My doctor is helping me to get some guideline, regular basis dieting, regular basis counseling guideline. So these are the things. And when you see your doctor is talking in different Facebook or social media, and you can correlate, the patient can correlate their problems or challenges with that. Also they will be more associated with the customer. And here as a marketeer, here as a former people, our major job is to be not to make a digital fatigue, but to also connect with the customer with a different angle or different note. Now, it's a win-win situation for everyone, whether it is patient to doctor, doctor to patient, or pharma to doctor, or pharma to doctor to pharma, or pharma to patient, or patient to pharma. It's all are the win-win situation. And just we have to think, we have to spend some customer, we have to understand their needs and create a lot of touch point and customized input for them. It is increase your reach, as well as it will be more effective. Remember, in this everybody, my all speaker, Srivastavaji and Sadipta, all talked about the financial crisis during this pandemic situation. And the financial crisis, if you see the PNL, and if you see the we have to manage the cost effectiveness to the organization level, as well as to increase the reach. So the best way, it has to be a physical world, which needs to be work more in coming days. So take home, if you see this things where there are a lot of works are going on, there are a lot of McKinsey, why everybody is working, how the different ways to come and different way we can reach to the customer, or what will be other choices or possibilities to reach the customer or reach the patient, to different platform, different way of social media. So and it is going to be stay for a long time. That's my prediction, and everybody will predict that. So focus has to be more on digital, but it should not be once again I am talking about, it should not be makes a fatigue to the customer. And obviously we have to run the show with a lot of cost effectiveness. So I think that is the few touch point I have tried to give to the my all viewers, that these are the way out. You can think about it, and you can make your choices, what to use and what not to use. That's but yes, this is the era of physical, and we have to be on that platform only. So thank you very much, and let's make a more digital and be more way to adapt it. So thank you so much.
Thank you, Shomendu sir, for taking the entire audience on this digital era. I would like to summarize the overall thing. Now, I think this digital era is upon us, and in this point of time, each and every marketing colleague has to redefine themselves to be relevant. right? In this marketing era where this entire digital transformation, which was not being taken seriously by pharma companies, now in this era, it has catapulted for 5 years ahead. So every company today is going towards digital migration. Lot of CMEs, lot of ad boards, lot of focus group meetings which are been happening through this digital is mushrooming each and every day. So all your slides speaks of your wisdom which you have gathered for long 18 years and handling marketing and sales functions. So together, sir, I think this digital fatigue also is coming in with the doctors. Now, with digital fatigues coming in, physical plus digital is the way ahead, which sir has already spoken of. So our overall solutions on communicating our product discussion with the doctors has to involve both the angles of physical as well as digital, because the overall patient flow, like before, the overall patient journey was only upon directly talking to the doctor, taking their medication. But now today the patient is also searching Google what to ask the doctor, what the doctor has given solution. He is also googling it. A lot of new things have happened, and these things have even given marketing a new wave of addition on digital tools. I think digital is an enabler right now, and it is giving more connects to the marketing colleagues. So I think thank you very much, Shomendu sir, to concisely discuss this entire points. So that's all. Thank you very much.
I think that's wonderful discussion. So on all the three fronts, so we discussed about the marketing challenges by Pankaj ji, and we had great insights on the opportunities by Sandeep Da, and finally we had physical, how the marketing and the pharma industry is embracing the digital in the industry by Soumyendu ji. So we had a very good discussions. What we would like to do is now I would like to recognize some of the many people have got where pondering their appreciation in the Facebook. uh, so Sanat can help me in the YouTube. Okay. So from Facebook, I would like to recognize that there are many people, but Jagadish Datti, Pradyumna Mishra, Shampa Ghosh, and Mukesh Jain, Jana Healthcare, and Baldev Chavan. Apart from our regular viewers like Armugam Arasan and Senthil. So these are some of the people who appreciated the all the speakers, especially on giving the insights on the industry. And there is one comment also which I would like to bring in here. The empathy and care shown by the organizations for their employees will keep the employees inhibited. So by Sampa Ghosh. So I think that has reiterated with all the three speakers who addressed the empathy during this difficult times. So now I request Arpan to give a small story before we go into the question and answers. Yeah, over to
Thank
you.
you. Thank you, ICS sir. And first of all, let me compliment all the three speakers for the wonderful deliberation and the presentation they have given to our live audience, both on Facebook as well as YouTube. Thank you so much for that. Now, it is always said that if we are really serious about achieving something, we will look for ways of achieving it. And if we don't, we will always look for excuses. So today I will narrate a small incident that happened to me in a form of a story. So it goes like this, that I was waiting in Calcutta airport one day for a cab. And the first thing I noticed that when the cab driver pulled up in front of me, the taxi was sparkling, shining, white. The second thing I noticed was that the driver immediately got down. He opened the rear door for me and then said, "Sir, please take a seat while I put your luggage in the trunk." So he handed me then a laminated card and said, "Sir, I am Anirudh, your driver. So while I am loading your bags in the trunk, I would like you to read my mission statement." Yes, a taxi driver handling me a card to read his mission statement. And it read, to get my customers to their destination in the quickest, safest, and cheapest way possible in a friendly environment. This was the mission statement of the cab driver. Well, that really blew me away. And especially when I noticed that the inside of the cab was spotless as the outside of the cab. And as he slid behind the wheels, Anirudh said, "Sir, would you like to have a cup of coffee?" Again, I was taken aback. He said, "Sir, I carry a thermos with me." But I said, "Well, I would like to prefer a cold drink." He said, "No problem, sir. I also carry a cooler with me in front where I have Diet Coke, lassi, water, and orange juice. What would you like to have?" I asked for a lassi. And that time I was almost flabbergasted because I was taken aback. I was absolutely surprised. So then he told me that, "Sir, would you like to read a newspaper? I have the Times of India, the Indian Express, and the Telegraph with me." I said, "No, I was pretty tired, so that I won't be able to right now read the paper." And if this wasn't enough, he said, "So the AC is on. Is the temperature okay for you, or you would like to have it a bit more cooler?" I said it was fine. Now I asked Anirudh, "Is this the way you treat all your passengers?" To which he said, "No, sir. I started treating passengers in this way for the last 2 years. I have been driving this cab for the last 7 years, and my initial 5 years, I spent most of my time complaining like the rest of the cabbies do. Then I heard the power of choice. The power of choice said that you can either be a duck or an eagle. So don't be a duck, be an eagle, because ducks quack and complain. Eagles soar above the crowd. So if you get up in the morning expecting to have a bad day, you are rarely going to disappoint yourself." So my first year as an eagle, I thought, "Okay, this is the right time where I can soar really high in the sky." And Anirudh made a difference in my life. He decided to stop quackling like a duck and started soaring like an eagle. Because if we start becoming like an eagle today, a small step every day, which are baby steps, but one day they will definitely become giant strides. Because it is said, you don't die if you fall into water, you only die when you cannot swim. So let us start swimming, because this pandemic is the basic ocean where we have all entered or plunged. So any person who dares to swim is not only going to survive, but going to thrive. So let us be an eagle and not stay back as a duck. So thank you so much, sir. Over to you, ICS, sir.
Yeah. Thank you, Arpan. It was really very powerful during this crisis times, because we have seen it's attitude that matters everything. Straight. So thank you for the story. So now we will have a kind of some questions which are coming from the audience. So the first question is to Pankaj sir. Sir, so the question is, so is the digitalization, because all three of you have spoken about digitalization. So digitalization is a strategy, or you think it's an enabler in the industry?
So there's a lot of debate on this, whether digitalization could be considered as a strategy. I would like to say it is an enabler. It is a part of the process. Because if you see in any organization, there'll be four compartments. There will be one strategy. Then, of course, there's going to be one process, one culture, and there's one more thing is there. So these are the four compartments under which it will be, you'll be working. So ultimately, if you ask me, this is going to work as an enabler, because ultimately, this is a conduit by way of which you are going to, give your strategy to your customers. So, I mean, it cannot be called as a strategy. It has to be called as a part of the process.
Thank you very much. So I think that has addressed my question. So now going to Sandeep Da. Sandeep Da, there is we have seen how the channel management completely changed during this pandemic, especially the acute has completely taken away the market, and it was a belief in the industry that it was the only chronic which will make you more relevant in the industry. But the pandemic has completely changed it. If you see, you also presented many things during your presentation, how the critical care segment and the acute segment has completely changed the game. So do you think that this will be a sustainable in the future for the companies?
Well, see, the acute overshadowed the chronic and the pharma industry during this pandemic was inevitable, because this pandemic, if you see, this was related to the infections, and any infection, so there will be anti-infective. This is obvious. And per se, this infection was a little critical, and majority of the patient was being landed in the hospitals. And when they're in the hospitals, obviously it is a injectable antibiotics which rules the game. And obviously injectable antibiotics will have much better volume than the oral antibiotics. Now, if you ask me what is going to happen in future, I will still believe that chronic will have its own space, and the kind of stress people are getting out of their work, out of the financial stress, and out of even this pandemic. Okay, so the diabetes, hypertension, and CNS, these three major pandemics, these three major chronic segments will keep on growing better than acute. However, if you see the population of India and the treatment facilities available to the Indian populations, the acute volume will always be more. Now, more and more hospitals, nursing homes are getting established in the smaller places, smaller tier. Your compensation of the acute market will always be more. So down the line, 10 years also, you see, the ratio between acute volume and the chronic volume may not be differ a lot, but the growth of chronic will always be more because they have a low base. Coming to critical care, second part which you asked, coming to critical care, I believe in acute, if the total acute grows by 10%, the critical care and hospital business will be grown by 12-13%. Though it comes under acute, but that is the way I can foresee, because of the intervention of the insurance, intervention of the private equity and the venture capitalists, because of the lot of infrastructures are coming up. So they need to generate patient because of their own survivals. So that's the way hospital business critical care.
Yes, so that's what I think in most of the companies have now come up with many divisions within the critical care itself. Because it was only one division, but now even Alchem has 2-3 divisions, Cipla has 3 divisions. So like that.
Because see, if you permit me 1-2 more minutes, I can tell you that earlier the critical care business was an ethical business, and majorly being influenced by the prescriptions. Now the critical care business is majorly driven in tertiary care. It is majorly driven by the CIPs, the procurement. So and they need a basketful approach. So you need to have a product portfolio. So the marketing need and the marketing intent in critical care has changed. Now you need to have a portfolio management within that, and you need to have a prescription management also within that. So probably you need to divide or segment your products in such a way that you have a team which will address the need of the procurements, and there may be a team which will be fulfilling the need of a prescriptions. That's the way I see.
Thank you, Sandeep. That was really insightful. So now I would like to have a question to Soumyendra ji. Soumyendra ji, now you discussed about how the change in the industry, especially the digital adoption that you have seen and you have already been implementing in your team. So what are the challenges basically that you have observed in your own team, or maybe in the industry, and how to address those challenges, especially from marketing point of view? I'm asking.
See, the first challenges, if I observe in my marketing as well as in a sales team, so the first challenge is that adopting any new thing is the mindset. So nobody wants to change a traditional, thing to new or different era. So here, it's most important thing is you have to have a correct mindset. Ki, yes, we have to survive, but what is the different ways? When people see the crisis, what Satya has rightly mentioned, it comes under the opportunity also. People don't see the opportunity. Now, why I should do digital meeting for an example of marketer point of view? They don't want to. They have a reluctant. It's better to do with a doctor's meeting, which you used to do in a hotel. But they try to reach only 10 customer. With this digital meeting, you can reach to the customer more than 1,000 doctor. And there is a conference I know 20,000 customer doctor participate in the conference. Now, what message you want to give as a marketer? It can be reached to them. Another point of view, earlier when we launch a product to the customer, for an example, the medical representative used to go to customer per day, 10 doctors, 20 doctors, but the quality of the articulation or the messaging, it matter a lot, and it's vary from one to one. But same times, today's scenario, if you want to go and launch a new product, you don't need to a medical representative to articulate properly. It has to be just like a brand reminder, because your doctor will now do the propaganda for the organization with number of CMEs. So if you see, if one KOL will engage another 30, 100, doctors and talk about the molecule. So that's an added advantage. Now, if you want to take this added advantage, that's up to you. Whenever the changes, those who picked up the first changes, those who implemented the first, they will be the survivors. So it has to be accepted, and we have to go with this thing.
Yeah, thank you. I think there is one question came from the Facebook from Armugam Arasan. So he was asking how much percentage of digital to physical meeting is ideal for this strategy. Like can we define any percentage?
So it's very tough to define any percentage. It all depends on the situation. So when there are possibilities higher. So just a minute.
Yeah.
So when it's all depends on situation, because there are a lot of different models are also coming. Now earlier we do our ad board with the 8 doctors only, right?
Yeah.
Now we are doing an ad board, but like this webinar through Zoom platform, we are taking 1,000 of viewers in the of the ad board. So ad board may be doing physically, but the all the viewers sitting all over the country see this ad board with different platform. So ideally it should be a mixed blend, because still we have to go long way. But defining percentage, it's totally depends on the situation as well as the opportunities what you are having.
Yeah, understood. Thank you very much. Yes, Pankaj. Yes.
I just want to add one. I just sorry.
Okay, Pankaj, carry on.
I just want to add one point here. What Samendu has said. See, earlier we never thought that this could be also one route by way of which we can reach out to the customers, right? Now organizations have realized one thing. It is a very cost effective way
Yeah.
of
Yes.
reaching out to a large number of customers, as he has talked about 20,000. I mean, I
Yeah.
know in RSSDI meetings, 6, 7,000, 8,000 is there on their every day, what they are having,
Yeah.
these meetings. So this is the power one thing. Now, I know that when the situation improves, When it will improve, we do not know, but whenever it improves, people will have a tendency to go back to physical, go back to the physical, right? There will be some amount of this dichotomy that, yeah, we want to go to physical, but we have realized that through digital means we were able to reach out to a large number of people, because you are saving a lot of cost. There's no cost of the hotel, there's no cost of the food, there's no cost of the travel, there's no cost of the taxis which we used to provide. I mean, all these costs you are saving. And what you have to do, you have to give honorarium. You can have best of the best speakers over there, right? Still, it will work out to be much more cost effective way. So maybe one-to-one interaction still with some of the key opinion leaders. Maybe we will try to do that. But I don't think now since we have tasted this now, the organizations would like to take advantage of this. So, I mean, as he has very rightly said, we can't, ascribe any percentage, but both the things are going to coexist moving forward. I mean, that's what I
Very
feel.
One more.
Thank you. Yes,
So
yes,
one
Sandeep.
Point of
one
view.
point is,
But if you see nowadays, all the doctor association also, they don't want to talk only with the limited customer. They want to reach everywhere, not only in India. If you see the recent trend of RSSTI, there are a lot of foreign speakers are also collaborated with a different Indian organization, and they are running the course. And these things are also now available in the different countries, in African countries where Indian companies are mostly marketing their products, or South Asian countries, or in the Middle East. They are also being a part of this conversation and idea exchange. So world becomes more opening to the Indian doctors, Indian pharma industry, Indian marketeers also. So it's an opportunity.
Yeah. Thank you, Sandeep. Yeah, Sandeep,
respecting both of their views upon Somendu and Pankaj, I see the things a little different way. The questions which has been put in, that what is the percentage of physical and what is the percentage of digital. I can foresee that 100% physical will be there as 100% physical. 100% digital also will be there as 100% digital. It will be a synergistic effect of 1 + 1 = 3. The way if you see, as of now, majority of the companies has not talked about the benefit of digital and reducing the field force. That itself is the major signal that they do not deny the impact of the physical meeting. So as early as possible, the things will be coming to normal. Even the companies will increase the field force. I'm sure for that. Because still there are doctors who are not being covered by most of the doctors, most of the companies in the specialties. But yes, there is an impact, the way Somendu told. Recently, I can refer, JB Chemical has done a multiple therapy conferences where they have registered 36,000 doctors, which is enormous. And for a 3 days conference, at any given point of time, there was a 20,000 plus doctors attended this. So this was not being possible unless in physical, even in the normal time. So
Yes.
that is why I'm saying that way Pankaj said that probably 6,000 or 7,000 doctors were coming in the physical meeting. So now 1 + 1 = 3. So physical and digital put together, probably that is going to be 3. So it's a synergy. So it is not going to, and that will, what will impact is the business. So I can see that last few years the pharma industry has grown by single digit, and now we are seeing that it is being double digit. Probably this double digit growth will be there for some time now. That's the way I see it, because I'm always optimistic, as you know. So till then it is not coming back to the single digit. I always see that there is something good happening.
Yes, that's true. Even I could I would ask Raman also. Like Entode has been a pioneer in connecting digitally with all the ophthalmologists across India, which is they have utilize this opportunity to the greater extent when compared to any other company as far as the opthal is concerned. So it's a great opportunity for those the young mindsets who are taking the change faster, adopting the change faster, and taken that as an advantage. Yeah, thank you. Any other questions, Sanat, from YouTube and Facebook? Sanat and Smith.
A lot of appreciation for all these previous speakers on YouTube. It was really appreciated. To name a few, like Ms. Preeti, Mr. Somnath Haldar, Mr. Pravesh Kumar, Mr. Subir Mukherjee, Mr. Subir Mukherjee, all of them had appreciated the speakers for that. There is one query which has been asked, and it is my personal thing. Also, I would like to understand that part. During this pandemic time, a lot of revolutionary changes had happened. Earlier, we had the crisis management as an opportunity, or the way we had taken physical as a route. I'm sure the medical fraternity is also looking forward for content-based marketing, which is actually not happening to that extent. So the way we had discussed about the collaboration for different departments, L&D and all those things, somewhere the resource utilization in building the capability of each team member is there in the every organization mind. If any of the three speakers can touch upon this, that will be a great help.
I believe during my deliberation, I have already touched upon that. But then your question, Sanat, a little tricky question, whether that is there in the mind of every organization or not. It's very difficult to say. Now, if you ask me, I will broadly differentiate the companies into two ways. One is MNCs and one is Indian companies, Indian bigger companies, large companies, and then the other Indian companies. Three ways. MNCs, it was always there. Their outlook and their Pankajji is there. So Pankajji has worked at two big multinational companies, and then he must be aligned with me. It was always there. It is not because of the pandemic. It was always there that they believe on science, they believe on competency development, they believe on knowledge disseminations, and they wanted to market their product in such a way that is based on science and based on prescriptions. Okay, so I'm just keeping out MNCs from that. Coming to Indian organizations and the Indian medium-sized to smaller organizations, what happened in this period of 13 months? For the larger organization, that thought of multinationals of science dissemination was there, but it was under the carpet, because when review was coming, probably 10% of the time of the review we were discussing on the science and the customer conversion based on the knowledge dissemination, CMEs, webinars, departmental meetings. 90% of the time we were discussing on other part like sales, vended brand sales, performance, growth, market share, all those things, which has changed, which I have seen, at least in my organization, I have seen there is a significant change in terms of ratio of putting the focus on scientific knowledge, competency development. So there's a conscious approach. It was a conscious approach to take this. We got this opportunity. Earlier, we were not getting that opportunity because our all representatives, all managers was in the market from the morning to evening. The sales target was the major priority. But now we got the opportunity. Let us make them competent. That was a conscious and clear approach. Maybe I'm not demeaning the smaller to medium-sized companies, but by compulsion or by choice or by chance, they do not also have any other choice but to spend or utilize this time for the competency development or the knowledge development of the people. So ultimately, what I feel that what has been done, that has been done whether by choice or whether by choose. I cannot name any company or I cannot name any organization per se, but then I believe that has happened good for the industry. So that is the way I can see.
So I'd like to just say one thing that, can I?
Yeah.
So
Yes.
what I would like to say here is, see what happens if you introduce any new concept in the market. I mean, unfortunate part is that most of the multinationals in India have introduced the new concepts. So I'll cite examples. When I launched Atlantis, it was a new concept where we were saying that fixed fasting first, say, and it was a complete paradigm shift. Now you have to discuss. I know what type of pitched interactions I used to have with doctors, especially from Calcutta, because they were most vociferous, in changeover, not so easily accepting this new concept. Same way, when we launched, say, Genuvia here in India, it was a new, absolutely new concept, right? So whenever you have to introduce any new concept, you have to discuss science, right? So irrespective whether it's an Indian, even if any Indian company comes out with a state of the art product, a new concept, they will have to discuss science, because without that, you just cannot promote your product. So that is why most of the multinationals, they had this mindset, because they were coming out with newer and newer products. And yes, you are absolutely right, they wanted to sell through science. When it comes to some of the other products, when you are introducing a sort of you are operating in the same segment. So there are hundreds of vildagliptins now, there are hundreds of tenaligliptin. The concept of DPP4 inhibitor is quite well established, and of course MSD and Novartis must be given credit for that. Now once that is established, now whenever you are coming, you are not going to teach any doctor about incretins and things like that, because everybody is aware about it. Now the challenge comes, what science you're going to talk. So you will generally talk about a little bit about, say, in what way it is going to be safe for cardiac patients, all these are the finer things on the basis of which you are operating. So there again, that the once you have got a new concept, you have got a lot of things to discuss. When you are going to operate in the same segment, there are very few things which you are going to operate, because you are trying to maybe take away some share. You are not going to develop the market. Whereas all those companies who are introducing research molecules, they take it upon themselves to increase the market. So once you have to increase the market, then obviously you have to disseminate a lot of knowledge, conduct a lot of sessions, etc., etc. So this is
Great.
what's happening.
Yes, yes.
Thank you so much, Ji. Thank
Uh,
you.
I think I will take 1 minute to if I take it in a different angle. It's all about the brands, how you want to build your brands, or because multinational always want to big brand building concept, and
Correct.
Indian pharma will how many new launches they can make in a year. So both are work in the different different
Perspective.
DNA, I can say. So operation DNA. So multinational is not having a choice to launch such a new brand in Indian market. So they have to work on big brand building, as well as they has to work on more on science. But today, if you see top 10 Indian companies, or maybe more than that, they
All
are
India.
also talking science, not on the molecule, but on the allied subject, or on services. So definitely content has to be robust and content has to be useful. Otherwise, people will not able to discuss. Even the same brand, people are talking on the technology, how technology can be defined or differentiate a brand. So it is always there, and it will always a big debatable, topic. What should be? But again, I will say so. Everything pharma, we have to make 1+1 = 3.
Three.
Uh, that's a choice we should have.
I'm sure my marketing colleagues must have got some
Yeah.
insight from
Yeah.
the three legendary speakers about this. Yeah. Thank you. Thank you.
Yeah, I think we had a great discussion and very insightful. So now let's, as a closing remarks, would like to have from all of you, one by one, starting with Pankaj ji, your closing remarks, sir.
So I would only like to say, I'm a big fan of Darwin. Changes the way of life, right? And we have to get acclimatized to these changing environment. And I always quote this, that only those people, maybe you are the strongest or you are the most intelligent people, but you will not be able to survive unless you're completely aligned to the changing situations. So this is a change situation, and we must embrace this change. And as everybody has talked about, that whenever changes are there, whenever difficulties are there, there are opportunities also. And you must see towards the positive side, ultimately, because you do anything. Stephen Covey has said, whatever is in your domain, you try to influence that. So that is all
Yeah.
what we can do. And therefore, if you concentrate on that, you will come out with the solutions.
Great. Thank you. Thank you very much, sir. Now, Sandeep Da, your closing remarks.
As a closing remarks, I'll have two parts. One is from today's perspective, today's topic perspective. I will tell marketing is always a challenge. It has been a challenge. It is a challenge. It will be a challenge. So let us take those challenge in a positive way, and then see how we can create more opportunities to tame those challenges, to combat those challenges, and come back. So all the best to all the audiences, all my co-speakers, all panelists, and Raman, ICS, all and audiences. Second part is thanks to LPC. Thanks for creating this kind of platform, and it should not be my closing remarks in LPC. It should be continuing because I would like to be a part of LPC. So I have been a part from almost from the beginning, last year, May, June, and then
Yes.
it's fantastic. I wish all the best to LPC.
Thank you, and it's a great way of because of the speakers like you who are voluntarily coming and taking the part in spreading the knowledge in the industry. So we value all of you. Thank you. Soumyendu ji, your closing remarks, please.
Yeah. So thank you very much for for inviting, and I really appreciate core of my heart that such platform or my experience can help a single audience over here. So I'll be very happy. The most important thing that we talk about, a lot of buzzword jargons, a lot of discussions happening on empathy, changes lifestyle. But one part is very important is whatever we are discussing, it should be implemented. If it is implemented on a one person who is the viewers, this is my appeal to all the viewers. Let's implement it, because unless until implement it, so when you will become a tomorrow's leader, so that will be the most important thing of life. So let's start implementing. Then only gradually we can be make our goal more easier. So that's a part I would like to touch upon in the closing.
Super. Yeah. The implementation is the crux of any success. Thank you very much. And on behalf of Life Pharma Coalition, we wish all of you a wonderful dads. Today is a Father's Day, and once again, thank you for participating in Life Pharma Coalition. Thank you.
Thank you.
Thank you.
So now we come to the end of the today's live pharma coalitions. That is the LPC
60.
I think this is the 68th sessions, young leadership session on the marketing challenges, opportunities, customer connect during this era. Thanks LPC platform to giving the opportunity to ask the word of thanks. So instead of I say thanks to all of you, I will like to say all the best to the speaker, because as everyone is saying that their journey is starting with the LPC sessions, and LPC is a nice learning and sharing platform. Currently, we do have it. This both the audience, live audience, Facebook page, keep liking and following our the page. YouTube channel, kindly do subscribe our all the channels, and I will specially mention the thanks to the who has supported to us. That is a KemiPay. KemiPay currently is empowering the retail segments. Last not but least, in the this marketing, most of the time the challenges and opportunity, it comes hand in hand to hand. Those who has the solutions to overcome the challenges and grabbing the opportunity, that's become the really the success for them. And the customer connect is open the wide window of the patient centeredness in the pharmaceutical industry. With this, we will end the LPC 60 sessions. Bye.
Bye-bye. Thank you.